the third exercise. So if I can get you to face this direction here. So what I want to show you guys is a little bit of an anatomy lesson here. So as the patient is sitting in this direction, this is how her pelvis looks in this direction here. I'm going to ask you at home to find two bony landmarks. This is the right sacroiliac joint, and this is the left sacroiliac joint, okay? So what we're wanting to do is we're wanting to correct a sacral rotation. In some patients, the sacrum can rotate towards the left-hand side. We would call that a left sacral rotation. In other patients, we will see the sacrum rotate towards the right-hand side, and that would be a right sacral rotation. So based on the area that your therapist diagnoses you with, either a left or a right sacral rotation, that's going to tell us which direction we need to correct the sacrum. And so let's say that our patient here has a left sacral rotation. What we're going to do is we're going to find this left bony prominence, the left SI joint. We're going to take this PVC pipe and put it right in this little divot here that is between the midline of the spine and that left bony prominence. We'll take that PVC pipe and put it right in there, and then she's going to lie back on her back, and that's going to put pressure up through the left side of that sacrum to try to correct that left sacral rotation. That would be in the case of a left sacral rotation. In the case of a right sacral rotation, obviously we would just put it on the right-hand side. So depend on your therapist to tell you whether you need to correct for a left sacral rotation or a right sacral rotation. So the way that we're going to do this with our patient here is I'm going to come around behind her. So I find bony prominences on either side here. Normally in most people there will also be a dimple in the skin on the left and right side. So this is the left sacroiliac joint and this is the right sacroiliac joint. Again, if we're correcting for a left sacral rotation, I'm going to come just inside and below that left SI joint, and I'm going to ask the patient to hold pressure with that PVC pipe right there. So again, there's our bony prominence. Here's her waistline right here. The PVC pipe is just inside and below. Here's midline, and so we're in between the bony prominence and midline on the left-hand side in the case of a left sacral rotation. In the case of a right sacral rotation, again, here's the SI joint on the right-hand side, here's midline. PVC pipe is just inside and below on the right-hand side. So again, correcting for a left, if you'll hold that right there for me, and then you can rotate over, lay on your back, and I want you to go with your knees bent there. So for this exercise, it's really important that we're on a firm surface. So a carpeted floor is probably the best place to perform all three of these exercises, but specifically this exercise here needs to be performed on a firmer surface. And she's gonna hang out in this position for about 2 to 3 minutes. It's pretty common that this causes a little bit of discomfort because there is a bone directly up underneath the PVC pipe here. So it's pretty common that you'll have a little bit of soreness, almost like a slight bruise sensation after you do this exercise. So again, hanging out here for a couple of minutes. And we generally want our patients performing all three of these exercises 2 to 3 times a day. They need to be done in sequence. And so this is not something that you would do, you wouldn't do the muscle energy technique and then come back 30 minutes later and do the hip sway and then come back 30 minutes later and do the PVC pipe. They're meant to be done all at the same time. You want to correct all three of those areas of misalignment of the pelvis at the exact same time. Thanks for listening.